people have asked me, how exactly is the Botox procedure performed? So I want to show you different parts of procedure, different instruments, so you have a better understanding of what to expect. Hi, I'm Dr. Alexandra Dubinskaya. I'm a urogynecologist and sexual medicine specialist. I would like to talk to you about Botox for the bladder. Injection of Botox in the bladder is a great option for the treatment of overactive bladder and urinary urgency, urinary leakage associated with this sudden urge to go. Usually people start with medications, but it can be annoying taking medications every single day. So Botox is a great alternative that works locally and removes the need to take medications daily. So Botox is a toxin that paralyzes the muscles. And we can use that special quality of Botox in the treatment of overactive bladder, because in that condition, bladder muscles contracting uncontrollably. When we inject the Botox in the bladder muscles relax and you can accumulate more urine before receiving the urge to go. The bladder Botox injections usually performed in the office settings, and there are different options for the anesthesia. You can get a bladder installation of lidocaine. You can also use a nitrous oxide, and you can also take azo, the medication that numbs the bladder, before you come to the doctor's office. So this is the flexible cystoscope. This is where the needle gonna go through, and this is the part that goes inside of the bladder. And you see there is a light and camera. So this is the Botox needle that we use to inject Botox inside of the bladder. And if you can see here, when we put the needle through the cystoscope, you can't really see the needle. But then once we're in the bladder, we can adjust the depth of the needle. So it's not like the whole tube goes in, it's just a little teeny part at the end. And I also want to say that this is not a sterile settings that we usually do the procedure. This is just to demonstrate you how it's usually done. So we insert the needle through the special channel, and you can look at the tip of my camera how needle will soon, very soon, appear. Okay? So when we insert the camera, we pull the needle back so it doesn't scratch the patient. And we have this wonderful model here. We insert the camera in the bladder. How beautiful fake bladder. And as we're inserting the camera in the bladder, we fill the bladder with saline to expand the bladder and to help us visualize better. And when we get inside, we start slowly advancing the needle. So you can see a needle over here. And when we go to the bladder wall, I can't really inject this bladder because it's a fake bladder, but we do injection, and we use just the regular saline to demonstrate how the Botox looks. As we're done, our needle goes back, our camera goes back, and we come out from our bladder. So the procedure usually takes about 5 minutes to perform, and you can go home, and there is no limitations on your physical activity. You might experience some bleeding or some urgency, some discomfort when you pee right after procedure, but that's pretty much it, and it goes away the next day. Some of the risk factors associated with the procedure of receiving the Botox is the risk of getting urinary tract infection. That's why some providers give you a 1 dose of prophylactic antibiotics to prevent the infection. So similar to the Botox that you receive in your face, Botox in the bladder can last anywhere between 6 to 12 months. So if you're the person who's suffering with overactive bladder, urinary urgency and leakage, Botox injection might be a good option for you. Feel free to schedule an appointment with me, and I'm looking forward to seeing you at Los Angeles Institute for Pelvic and Sexual Health.